After general residency, I did do an addiction fellowship, and that's kind of the area that I was interested in working the most, because I feel like that's what I was most exposed to, just in my personal life and kind of my relationships. So I have wanted to work with that population, with people who struggle with addiction. And I feel like here, definitely I have that opportunity, whereas in some other settings it kind of was not really addressed, or people really shied away from wanting to treat people with severe addiction or severe behavioral issues. No one really exists with one diagnosis in a vacuum. There's always kind of numerous things going on. For instance, typically someone with a severe alcohol problem or drug problem, they usually have an anxiety disorder or a mood disorder. And then if you kind of scratch the surface a little bit more, a very high number of those people do have some form of eating disorder or problems related to food. And if you want to go deeper, then it's kind of where are these things coming from? And that's when you can kind of uncover micro traumas or really large scale traumas. And so I think that's kind of the heart of the matter, and sort of looking into those issues. Because it's kind of, you can help someone stop drinking or stop doing a certain damaging behavior, but unless you sort of look at what's underneath all of that, it's going to be really hard to make any sort of long-lasting changes. So I think it's really cool that I get to work in a place where everyone is sort of on board with that model and kind of looking at the person like as a whole person.